Dr. Jaffe, we know that the ideal pH, urine pH first morning should be between 6.5 and 7.5. And that we often say that above 7.5 on a consistent basis um, shows that we have catabolic illness. Can you explain that a little bit more? How scared should we be if we get a consistent 7.5 pH?
Well, the emphasis there is on the consistent. If it's 7.5 occasionally, that's normal physiologic flux, normal physiologic variance. If it's 7.5 or more on a consistent basis, if the strip is blue, then the ammonia that is derived from amino acids that are being cannibalized for energy. Notice what I said, catabolic illness, in essence, tears down the body, amino acid by amino acid. So you waste protein, you increase the risk of bone disorders, of joint disorders. But the most important thing to know is that it has a cause and it has a treatment. The cause is due to why the body cannot use carbohydrate to make energy. Why does the body go to backup systems, fatty acids or amino acids, for energy, for survival? So catabolic illness is a very important and often overlooked aspect of clinical care. What causes catabolic illness? Well, stress, surgery, eating foods that promote digestive disorder, processed foods, and the like. And what is the solution? The solution is to identify what is needed, what is essential, that is not coming in. Because when the essentials are present, the body doesn't go to tearing the proteins down, doesn't take the amino acids apart, doesn't cause ammonia to be in the urine, but also in the stool and sweat. I was talking recently with someone who had surgery and probably has catabolic illness post-operatively. And she said that she noticed that her socks smelled of ammonia. And they didn't used to smell. To me, that was a confirmation that it really was catabolic illness. I don't know how often ammonia will be detectable in socks or apparel. But if you measure ammonia properly, which means under oil and properly, you find an increase in ammonia in proportion to the pH increase. And when the catabolism, when the amino acids being converted into keto acids stops, because there are better sources of energy now available, due to taking in enough ascorbate, taking in enough magnesium choline citrate, taking in enough of the essentials that the body can process without relying on a backup system that is survival. Catabolic illness is scary. It sounds, it's a big word. It sounds like it's something that should be scary. What it means is the body is not restoring and renewing itself, it's tearing itself down. Now, if your choice is surviving or not, it might be a good thing to sacrifice some muscle. That's called sarcopenia. To sacrifice some bone, osteopenia, osteoporosis, to sacrifice some joints. Large joints are very intensively renewing on a consistent basis, and it takes a lot of energy to do that. So we want people to be aware of catabolic illness, but not afraid of catabolic illness. We want people to know that catabolic illness is very common, especially after stress and trauma, but that you can physiologically restore the misfunction, the dysfunction, the lack of function. And what I mean by that is you shift back to carbohydrate and some fatty acid metabolism, and you let the amino acids be the amino acids that they want to be and build up the proteins, muscle, bone, and joint. So yes, catabolic illness is a concern, but it is a concern that has a solution and that we can help with. And more importantly, it's an indicator. Catabolic illness indicates that the body needs more of the good and less of the bad. That's the essence of catabolic illness. More good, less bad, and it goes away on its own.